Hi, I'm Nicole. I'm going to be demonstrating conventional tens today. So Emily is here because she has had surgery for a sublux patella. She's 2 weeks post-surgical repair. She has a 5 out of 10 pain, and we're going to do tens to try to decrease her pain. So the first thing I'm going to do is check for contraindications and precautions. So I would ask if she is pregnant. I wouldn't do it in proximity over a pacemaker, or if she had a pacemaker, for a over the carotid sinus, for a DVT, or if I was doing HVPC, which would be more for wounds, I wouldn't do it if she had osteomyelitis. Okay, so I'm going to check her sensation of the area. So we're going to do her right knee. So I would do with my paperclip, dull and sharp, and I would have her close her eyes, and I would have her tell me what she feels.
Dull. Sharp. Dull. Dull, I think.
Good. Over the whole area. So conventional tens is going to be biphasic and continuous. I'm going to clean the area. Okay, it's nice and clean. I'm going to place my pads. So we're going to do 2 channels crossing the area. And they should be at least 1 inch apart. About 2 inches is good. And I'm going to be using this machine right here. So I've got my 2 channels plugged in. For conventional tens, I'm going to set my pulse rate, which is frequency, and that is going to be between 100 and 150. This machine only goes up to 110, so I'm going to set it at 110. And then the pulse width is the pulse duration, and that's between 50 and 80 milliseconds. So I'm going to set it, microseconds, sorry, at 75 for this machine, just so I can be exact. And then for this one, you can control the channels at the top. So I'm going to plug the channels in. So this is going to be A. They're going to cross. This is going to be channel B. And then what we're going for is a sensory stimulation. So I'm going to tell my patient that she's just going to feel like a light tingling sensation, and it shouldn't be uncomfortable. There shouldn't be a muscle contraction. So I'm going to turn it on. So you have to slightly turn the channels on to turn it on, and I'm going to make sure I'm on normal. To change that, you could press mode, but we're at normal. We have our settings set up. And then I'm going to let her know. I'm going to start turning you up, so let me know when you start to feel it, okay?
Mm-hmm.
You can only do 1 channel at a time.
And I'm starting to feel it.
Okay. I'm going to switch channels.
And I'm starting to feel it.
Okay. So we're going to make sure she has just a slight sensory stimulation for the gate control theory to decrease her pain. You could do this for up to 24 hours, and that's it.